Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about the relationship of oral systemic health and tick-borne illness. And I went to a webinar of Dr. Alex Volchonok on Sunday, and it was outstanding in regards to his understanding of the role that the oral microbiome plays in the sustaining of inflammation in a chronically ill patient. It was really interesting, and how infection can hide can hide deep in your teeth pockets and in your roots and in your gums and even get into your bone. And that's what a cavitation is that the infection gets into the bone, and they literally have to go in there and sort of scoop it out. And then what he was explaining is they sort of clean it out um, with instruments, but also with ozone, which is really interesting because ozone is so healing to tissues. It's the application of very concentrated oxygen to the tissues. And then they use red light laser to help the wound heal. And they also do some detoxification using IV glutathione and IV nutrients to really do a holistic approach to treat the oral systemic health problem, whether it's a root canal or a cavitation or gum disease or gingivitis or periodontitis. They really do a very thorough job of making sure that your mouth is a healthy orifice, which is great because, as you know, tick-borne illness loves to go into the mouth and cause a lot of trouble. And in particular, Lyme and Bartonella love the mouth. They just love the oral cavity. And I think COVID does too. Like Dr. Volchonok said, there has to be an underlying injury. And that injury could be a root canal, it could be a wisdom tooth extraction, another tooth extraction, and then the wound acts as a place of festering for pathogenic bacteria originating in the mouth, including Borrelia burgdorferi and Bartonella, and probably other ones as well, Ehrlichia, Anaplasma. There's just not that much research on it. And then he talked about how they use plasma-rich protein, and they use fibrin, and they use a bone graft to help heal the wound. And by the application of all of these different things, the wound in your gums and in your bone heals much more quickly, which is really fascinating because generally speaking, people with tick-borne illness do not heal well. And the reason they don't heal well is that they have immune dysregulation. And they have immune dysregulation because they have multiple pathogenic, bacterial, parasitic, fungal species in their body that doesn't allow them to heal. And so, that is why wound healing is difficult for Lyme patients, for chronic illness patients. So, in any case, I'm really thrilled to be working with Dr. Volchonok. He is a wealth of knowledge about the way in which the mouth and the oral microbiome plays a significant role in sort of maintaining chronic inflammatory response syndrome, just like mold, CIRS, CIRS. And so I'm really thrilled to be working with him, and I think he's a wonderful person. So I hope that you found this information useful, and I hope you have a wonderful day. Take care.